Hi, this is Dr. Kimberley Linert, author of Visualizing Happiness in Every Area of Your Life and host of this podcast, Incredible Life Creator. And today I have with me Elizabeth Kipp. Hey, Elizabeth.
Hi, Kimberly. Great to see you.
I am happy to see you too. And I am very excited and passionate about teaching, having you teach us what you have learned over many, many years from, your own experience.
It was a long journey. uh, you want to hear a little bit about my story?
Sure. I was going to read your bio, just a
Yeah,
short bio, just so people can get to know who you are.
sure, that's fine.
So, Elizabeth Kipp is a stress management and historical trauma specialist who uses trauma trained and yoga informed addiction recovery coaching, ancestral clearing, compassionate inquiry, and yoga to help people with their healing. Elizabeth healed from over 40 years of chronic pain, including anxiety, panic attacks, and addiction. In long term recovery, she now guides others to unleash their healing power, find freedom from suffering, and live a thriving life. She is the international best-selling author of The Way Through Chronic Pain: Tools to Reclaim Your Healing. Yes, now I'd like to hear your story, Elizabeth.
Great, great. Well, thank you for that beautiful introduction. Yeah, the chronic pain story is unfortunately not uncommon. Hopefully nowadays it's getting less common, but I had a back injury. I when I was 14, I uh, took a fall off a horse and landed on a rock and split my fifth lumbar in two, and it split front to back and pulled the leg nerves with it. And I I have kind of a um, I pain and I have kind of an interesting relationship. Just kind of my upbringing, no pain, no gain, and lots of sports and difficulty in the emotional difficulties in the family. I didn't realize I was a chronic pain patient, like really as a teen, as a young, below 10 years old. And when I was 14 and had this accident, I was able to get up and walk away from that accident. So, and I'd hurt, but I didn't, because I could walk. I didn't think I'd done any particular damage beyond a bad bruise. And even though I told my father what happened, he's like, he just no X-ray. And it wasn't until 7 years later that we took an X-ray when the situation got so hard that I couldn't walk upstairs at night because of the pain in my back. Then I got an X-ray, and the doctor says, "Oh, you've got an old injury here." And I was like, "Oh, I know what that was." And I had no idea I had this break, but there was a break and a slip, so it was two things. And anyway, another 7 years passed, and the whole time there was pain. But I did things like traction. I was able to kind of pull myself up and hang from stuff, rafters and stuff, and give myself some traction. That was helpful. So I kind of dealt with it for 14 years, and my back became quite unstable, and the doctors. I have been working with a chiropractor, and the chiropractor said to me one day, sometimes our patients need surgery and you're one of them. And so all the other doctors had said, oh, you need a fusion. And I'm like, I don't want to, I don't want to, really don't want to do that. And anyway, I went and had, it took uh, three surgeries to get that slip stabilized, and a fourth corrective surgery. So it was four surgeries altogether to get that stable. And there was just so massive amounts of pain. And every time I had surgery, the pain got worse. And so the pain medicine that they gave me, got higher and higher, but it didn't seem to, really help the pain. So they had me on opiates and benzodiazepines, which is an anti-anxiety medicine, because I was so reactive to the pain, and to try and calm me down. And Anyway, I was on that for a long time. I was on, and the last 15, I was on all that for 31 years, and the last 15 of that was fentanyl and Ativan. You're not going to meet too many people that were on fentanyl for 15 years and lived, right? So, so that's an astonishing statement that I just made. And how I got there was that the doctors that I was working with, until the one I finally found that helped me heal, their their understanding of chronic pain at the time was you can't heal from chronic pain. And because I had a science background, I got trained as a research scientist here at the University of Kansas. And because I had that background, I knew that they were that statement was inaccurate. You can't heal from chronic pain. That's like, you know, first of all, doctors are not fortune tellers.
Mm-hmm.
Second of all, they're operating in a scientific paradigm and paradigm shift. Third, you can't heal from chronic pain. They're not even being honest about the science, the scientific framework they're working in, because science is not about facts, it's about probabilities. So they weren't being honest. They should have said, it's probable that. They didn't. They said you can't. So I knew, I was devastated by that whole thing for a while. And then I was like, I know there's something wrong with this. It doesn't make sense, right? So um, anyway, so I knew another thing. This is a really important part of the healing. They were operating in a scientific framework, like I said, and science can only comment on that which it can observe, measure, and describe. It can't talk about anything outside of that. But we live in the all that is, not just in the part that science can observe, measure, and describe. So that's where we heal, in the all that is. And I knew I was going to have to look not just in the science, but I was going to have to look outside of the science to find my answer. And that's kind of my story. And I did finally found a doctor who was trained in Eastern and Western medicine, who really understood. He was a brain physiologist and really understood what chronic pain does to the brain, which none of these other doctors knew, because this doctor had studied it. And I was so blessed to be in his program. And I went into his program, and he helped me get off all that medication. And I walked into his program with 40 years of chronic pain. And after 52 days, I walked out with no pain.
That's amazing.
He used holistic. He got me off the medication, which was helping to lock it in and lock in the pain. And he helped me, um, he helped me really turn on the healing power in me and help me kind of reset my mindset around what was possible, and very helpful. So, and the thing is that it wasn't that I was so special. He had a 94% success rate in that program. So, a holistic approach works once you understand the nature of chronic pain.
Yeah. So, just some basic questions. And I was telling you before the podcast that, I knew a lady that was taking quite a bit of pain medication just so she could go to work and be at work. So, what do pain medications actually do? I mean, are they actually helping the pain, or are we just taking them thinking they're helping the pain and they're not really even helping the pain?
Great question. I'm gonna hit that at a certain level and not go any further, because this is not like a sciency. I'm not going to go into the biochemistry, but we'll hit it on a little bit more superficial level, but still get the point across. So it's not that I'm against opiates or benzodiazepines. They have a place. I'll give you an example. I had a kidney stone. It was a 4 millimeter kidney. That's a big stone, and it doubled me over. And already told you I get pain. I don't even know I have it until it's really bad. So for me to say I doubled over from that, it's like that's a lot. So it's very painful, right? And I ended up in the emergency room, and they gave me Dilaudid, and the pain just right. And that's the only time I needed medicine for that kidney stone. The rest of it was just drink a lot of water, like a lot of water. And fortunately, you know, time and water, and it worked its way out. I'm not saying that it's that way for everybody. I'm just saying I was so activated by the pain of that kidney stone, I could not settle down. I just I was so there was no way I could sleep.
Mhm.
So I can understand, and if you've had a trauma, like you've been in a car accident or something like that, you need pain medicine just to help yourself, kind of like deal with the situation. But long term, there are no studies that show that opiates or benzos uh, heal chronic pain. And really, we're focusing right on the opiates right now because of the question you asked. Here's what opiates do besides the numbing thing that they do. This is also what they do. They paralyze your intestinal tract, so now you're not digesting your food well.
Mm.
They dehydrate you, so now the water that you drink is not getting distributed to all the cells. So now you're not getting like that. It depresses your respiratory system. So now you're not getting, proper oxygen and release of toxins from the lung. So explain to me how any of that is healing. You're shutting down like these major systems,
Mhm.
um, and those are just three right off the bat. So, and I'll tell you something else that's kind of interesting. Remember, I told you Dr. Prescott, his name was Dr. Peter Prescott. He taught us holistic ways of healing. One of the main ways to heal from chronic pain and just really to calm the mind and calm the brain and calm that reactivity is to meditate. I had a long meditation practice, but I wasn't applying it accurately. And plus the pain medicine was kind of getting in the way. And he helped me kind of refocus that. I got out of his program, and about 3 years later, well, that was like 12 years ago. 3 years later, I fell on my arm, and I broke these two bones in seven pieces right at the forearm. And that's a big break. And the blessing of that accident was when we saw the X-ray, the pieces all broke in place. Like they didn't twist, or like it was we were all astonished. Like, oh my God. And so all they had to do was split it. But it was a big thing. And they said to me that night, that when I was at the hospital, they said, here is your prescription for Percocet. And I said, like, I'm in recovery from that. And like what are you doing giving me that? And they said,
Mhm.
take it now because you're going to feel a lot more pain tonight. And if you come back tonight, we won't give you any. So that was kind of like a mind thing that was happening there. And I was like, fine. So I took the script and I got it filled, and I took the bottle home and I put it in my bathroom. And you know what I did while I healed? I meditated because I knew that if I took that medication, it was going to dehydrate me. I wasn't going to be able to breathe well. And I knew that any kind of food I was ingesting wasn't going to even get through. So why would I even do that? And
Mhm.
the meditation was helping me sleep. Okay, so and not only did I heal from this, but my orthopedic doctor, my acupuncturist, and my functional medicine doctor, they all were shocked at how fast I healed. Yeah.
Oh, amazing. I know I've been trained in hypnosis, and I haven't worked on someone like this, but I know people who do hypnosis and they actually hypnotize people for surgeries, for childbirth, for different things things that typically would cause some pain, and they hypnotize them and they don't feel the pain.
Yeah, the mind is a very powerful instrument. We just have to learn how to use it appropriately.
Exactly.
Yeah.
Now, when I read your bio, there were several things in here: stress management, historical trauma specialist, addiction recovery coaching, and then there was something else, the ancestral clearing, um, and even yoga. So you have all these things. How do you put them together? How do you
Oh,
use them to help people?
yeah, that's a great question. So the umbrella practice is stress management, and those other things are tools that I use in that stress management program, and they're all tools that I've used. I don't teach anything that I haven't actually tested, test driven. Like that's just how I do it.
So,
Um, It's an interesting question. Everybody's different, and it's kind of what their needs are. Depends, but generally, this is what I do in a session with a client. The very first thing I do is assess the state of their nervous system the best I can, and if they're dysregulated, then we start with the 3-minute breath practice, which I love so much because people usually don't know how to breathe, or they've forgotten that they can, or they don't know how to do it consciously and effectively, and so forth. So I take them through a very measured conscious 3 minutes of breath practice, and you know what happens? Their whole nervous system calms down.
mhm,
And so in 3 minutes, that client who came in dysregulated, feeling like life is doing it to them, all of a sudden realizes they have some power to change their state. So they go from powerlessness to feeling empowered. And I love that so much. So I start there. And then the second thing I do generally is I do an ancestral clearing, which is an interesting energetic practice that we do to help people release the negative imprints of the past. Now that can be 10 minutes ago, that can be in their childhood. That's usually a root in the lineage somewhere, which is where the historical trauma part comes in.
mhm,
I've done a lot of studies on that. I've done spent a lot of time in those kinds of um, uh, groups where we look at that, and I'm about to go in another one. I'm about to drop into another one with Linda Tai teaching about, um, attachment theory. She's bringing in the ancestral component of attachment theory. So I'm really excited to learn about that. So the ancestral influence on us is profound,
mhm,
and and a lot of times we don't know what we're carrying until we don't carry it anymore because we came in with it and we're used to carrying it. Right?
mhm.
Yeah.
Oh, yeah.
The addiction recovery, I work as an addiction recovery coach as well. Um, their stress management, is also breath management. Stress management is breath management. So I always start with the breath. And I also do, I'm not sure I had that in my bio, but I work with Dr. Debbie Silber on her post betrayal transformation institute site, which is dedicated to healing people that have experienced betrayal. So I'm a betrayal trauma recovery coach there. And that's a little bit different than straight addiction, because betrayal hits us a little differently than just straight up, um, you know, other things. Betrayal's kind of got its own flavor. So I have a little specialty in that. The yoga is really important. That's I mean, the yogis knew about breath. Our life force energy comes in on the breath.
Mhm,
So they say, if think about it this way: we're born on an inhale, we die on an exhale. The quality of our life depends on the quality of the breath in between that inhale and that exhale, and how we leverage the breath is what yoga's. I mean, that's one of the 8 limbs of yoga. And it's if we really know how to use our um, to leverage the life force energy that's in the air and bring it in, and it vitalizes the body. So we have good nutrition, we have movement, we have good sleep, we have good breath, we have a clean mind, meditation to help with the mind, and we have community connection. These are all things that are healing, and these are all elements of any kind of addiction recovery, any kind of recovery, whether it's addiction recovery, physical, trauma recovery, betrayal trauma recovery. These are all aspects of that. Yeah.
Mhm.
And the ancestral part, of course.
Yeah, so lots of pieces that you can work with. And when you talked about uh betrayal recovery, when I think of betrayal, I think of being just socked right in the solar plexus. Like, I mean, that's kind of how it feels, doesn't it, when someone betrays you? Like they just knocked the wind out of you. It was like a sucker punch, and it was not expected and upsetting and hurtful.
Yes, and it also threatens our sense of safety.
Hmm.
And so that sits right at the at the base of the spine. So it's solar plexus, then our the base of the spine is affected, our safety, our resources, um, and then the the that next chakra there at the hip, between the solar plexus and the root, that's where guilt and shame live.
Hmm.
So that's a heady mix, and you really can't, from a yoga perspective, you can't you can't clear the solar plexus chakra until you've cleared the chakras below it. So
Mm.
when you said, feels like a hit to the gut, you also feel like your feet just get pulled out from under you, and
Oh,
that's
yeah.
where it's showing up in the root.
Yeah, that
Yeah,
makes total sense.
yeah.
So, how do you help people feel safe again?
Oh,
What
well,
happened?
yeah. That's that would be, that would be a whole that's a whole process. How do you help you? The first thing you do is you teach them how to breathe. Why? Because there's a profound connection between a long exhale and calmness in the nervous system.
Mhm.
So you can't think your way into feeling safe. You can't positively affirm your way into that. It doesn't, you can't work from you have to start at the level of the nervous system. The nervous system actually has to feel safe in order for you to even begin to kind of connect back to you, have a sense of belonging to you, have a sense of belonging maybe to a higher power, to others. Then you can learn. But there's an order to healing, and it begins with safety. And so the breath, that long deep breath, regular breath, takes the brain. Now it's a practice. It takes the brain out of this chaotic, you know restless state into this calmer state. But you have to use it as a tool. There's a whole art to that. Yeah.
Mhm.
That's a short answer.
You are talking a lot about the breath. Is
It's
there
that
just
important.
like a short exercise you can take us through as far as just how to?
Sure. Yeah. So it's a real common one. it's This is good for balancing the emotions, because it balances both hemispheres of the brain, and it works on that part of the brain, the emotional center. And it helps us with sleep, and it helps with headaches. I was just talking to somebody today who was dealing with migraines, and I had migraines for 7 years, by the way. It was part of my chronic pain experiences. Oh my God. Anyway, um, it's also helpful for migraines. This thing I'm going to teach you. So it's very simple. So we're just going to sit evenly on both sitting bones and straighten the back. Bring the chin in just a bit so the back of the neck is flat. You want full access to the lung here, which is why we're sitting this way. And I just want you to cover the right and inhale on the left. And then cover the left, exhale right. Inhale right. Switch, exhale left. Always switching just before the exhale. Inhale left. Switch, exhale. Inhale. Switch, exhale. Inhale. Switch, exhale. Just keep us here for another minute so you get the effect. Inhale. Switch, exhale. Inhale. Switch, exhale. Inhale. Switch, exhale. Now just relax the breath down, relax the hands down, breathe normally. Just notice how that feels in the body compared to where we started. Do you notice a shift?
Yeah, calmer, even more open,
Yeah,
more
a little
relaxed.
more expansive. Yeah, and that
Mhm.
was maybe like a minute and a half. It takes 3 minutes when you're kind of agitated and dysregulated. It
Mm,
takes 3 minutes for the nervous system to actually get the message and uh, to really, feel like, oh, I'm safe after all, right?
mm,
What are we doing? We're working on the 10th cranial nerve called the vagus nerve, which runs through the face and the neck and down into the heart and all the organs. Um, and it's our threat assessment and social engagement system. So when it gets activated, it's our threat assessment system. So it's like, oh, I'm not safe. So when we do that work, we're actually communicating with the vagus nerve and it's, oh, I'm safe after all. And that's what's happening. That's the nutshell on that. Yeah.
exactly. And the little I know about the vagus nerve is that it also can cause some referred pain. Like when you get pain and you don't even know where it's coming from, sometimes it's that vagus nerve traveling around
Mhm.
when you think you have a tummy ache and you actually have a shoulder ache and you don't realize it's coming from your shoulder, but all of a sudden you hurt somewhere other than where it's supposed to be hurting.
Well, we're all connected. It's all connected. um, yeah, you need to get a rolfer on or somebody that works with fascia and you could have a whole field day with them. That's not my area, but I appreciate they really understand that they can hit me up here or down behind my knee and it affects up here. It's like so cool, right?
It is very interesting how we are all connected and there's so many, modalities to help. So
Sorry.
now that you hit on that, people are going through chronic pain. I have found that like massage is very helpful, but it's temporary, right? So it helps, but
Okay.
then, next
Mhm,
week I need another massage.
mhm. So now you're hitting at what is chronic pain. So let's give the listeners a definition
Mm,
and what it is, right? So chronic pain is any pain that's felt 15 days out of 30 for 3 months or more. Any pain, physical, mental, emotional, spiritual, sexual, financial, whatever, it all sends the same signal to the brain it hurts. So the brain can't distinguish between a broken bone or a broken heart.
mm,
It's all the same. That's profound. Chronic pain is not all about physical pain. Chronic pain can, emotional pain can journal over into chronic pain and vice versa.
Mhm.
But it all is the same signal. It hurts in the brain. So now we have an understanding of what chronic pain is. Most people think it's just physical. It's not. So why is chronic pain different than acute pain? So in acute pain, so we have a stress response in the body, which gets activated when we're under threat. It's part of the vagus nerve, is part of that. It's not all of it, but it's part of that. The stress response gets stimulated. It goes into the on position. The the organism does whatever physiology and psychology is necessary to meet the threat. The threat is taken care of. The stress response goes back into the off position. That's the stress response in a balanced, and that's what happens in acute pain. In chronic pain, the stress response gets stuck in the on position. We're not made for that kind of stress. We're not made for like constantly being, on alert. We're not made for that. So it creates a lot of toxicity in the body, a lot of metabolites and stuff like that. There's a lot of physiology and biochemistry involved in meeting the threat of a nervous system that's hyper vigilant, and it creates a lot of these byproducts and so forth. I just had a friend who had a migraine. Again, what's the migraines tonight? I had a friend who had a migraine over the weekend, and and we did some ancestor clearing with him, and it helped it clear. And what was interesting was I asked him how he was, and he said, the pain's all gone now. It's just the brain fog. And I was like, oh, that's the metabolites from the stress moving through the system, right? So the idea there was like, do your breathing and drink plenty of water to wash it out, right? Okay, so chronic pain changes the way the brain uh, kind of it changes the brain. So it becomes, instead of this balanced on off thing, the brain is constantly looking for a threat. Our emotional, it hits the emotional center in the brain, so that we're more negative. We're already a little bit negatively biased just to kind of keep ourselves safe in the world, but it goes really extreme in chronic pain. You're bad, I'm bad, the world's bad, it's all your fault, all the, like, all that. I'm bad, I'm not enough, all the things and then it'll ruminate. We'll just
Mhm.
stay there, right? These are all, and also there's chaos. I don't remember what I just did. I know I had my keys. What did I just do with them? It hits that part of the memory part of the brain. So uh, chronic pain has all those changes in the brain. So when we heal chronic pain, we have to heal the changes that happen. We have to bring modalities that heal those changes. Massage is one of those things that helps us. But here's the thing: if we're in chronic pain, now we have a stress pattern. And I was in it for years, and I still work on that, by the way, even after all this time. I'm still addressing the old pattern, right? It's much calmer, but I still do my practice every day to remind my nervous system, this is how we're doing life. We're not doing it like this, right? So we have this stress pattern. Oh, this is how we do life, like this, right? That's what happens in chronic pain. Well, that's a habit. And the nervous system now has like a wiring. And the more you access that wiring, the faster you're going to reference that. It becomes your default. Now, I'll take you into physics for just a moment on a kind of a superficial level. An object in motion stays in motion until acted on by an equal or opposite force.
Mhm.
A habit is an object in motion. So, in order for us to change the habit, We need to bring in an object of equal or opposite force. Meditation is one of those things.
Mhm.
Massage is one of those things. Proper diet is one of those things. Maybe even hypnosis. I'd have to go and look at the research, but it wouldn't surprise me because of the depth that it works on the mind. Ancestral clearing is another one of those things. So we're working with, so just so you kind of understand the forces that we're working with here. Did that answer your question?
Yeah, yeah, it really did. And we're kind of talking about, some pain comes from the body, some pain comes from the mind. I mean, you had a physical problem. Your bones in your back were split,
Yeah, but I also had
split
mental,
too.
I had psychological problems, emotional problems I didn't even know I had because it's the environment I grew up in. I thought that's just the way life was. And it
Mhm.
wasn't until I got in Dr. Prescott's program, I was like, oh, I have emotional stuff too. And
Uh-huh.
that was that because here was the thing. The doctors just said to me, you can't heal from chronic pain. They never asked the question, why isn't Elizabeth healing? Peter
Uh-huh.
asked that question.
Mhm.
You see the difference?
Oh yeah.
And it had to do with not just the physical, what was locking it in place, the emotional.
Yeah. And I had a question about and I think this is misdiagnosed so much and ignored so much by doctors is that chronic fatigue syndrome, and it happens more with women, and especially if they go in and see a male doctor, and I'm not prejudiced or either way, but they go in, they tell him I'm hurting all the time, and the doctor says, "Oh, it's your emotions," or they give him a psychotic drug or something, but either way, they are feeling physical pain, some to the point where they won't even get out of bed,
Mm.
but yet, every physical, uh, examination finds nothing wrong.
Well, I'm not exactly sure what your question is, but I will give you this answer. If you saw three patients' x-rays that look just like mine and my back, you would discover that there were three different outcomes. One, one of those patients would have pain all the time. The other one would have pain only when they're stressed. And the other one would have no pain at all. How do you explain that variation just looking at the x-ray? You can't. So looking at it from a reductionist model doesn't work. We have to look at the whole picture. When I met Dr. Peter Prescott, who was the guy that took me through his pain management program and helped me heal, he did not want to look at my records, which I didn't even understand. He said to me, I don't need to look at your records. I want to know who you are. And nobody ever asked me that question.
Mhm.
It's like, who are you and where have you been all my life? was, was was what I said to him when he said that.
Oh, cool. So when he is assessing you, is he assessing your beliefs, your values? What is he assessing when he wants to know you? What did he mean by I want to know you?
He was That's a great question. Poor Dr. Peter, he passed away in 2016, and I wish he was there to answer that question because I can't read his mind. But I can tell you this. He understood the nature of chronic pain. He understood the nature of addiction and its roots, and which would be trauma, and unresolved trauma. He understood the ancestral piece because that's where I met Ancestral Clearing was in his program. And he understood energy because he started out at the age of 6 with kung fu, doing kung fu. So he had this, Eastern. So he really understood qigong and energy, and so Peter was operating on all these different levels when he was evaluating me, but mostly he was reading the energy.
Mm.
Very interesting, this guy. Um, but I really can't answer that question for you because Peter was unique and I would love to hear his answer to that question.
That is beautiful. So, you know, let's say someone has chronic pain, you're working with them, they're doing their part, they're doing their meditation and their practices. Um, the thing is they only know what they've been doing for so long. So how do you help them move or become that new person they want to be?
Well, that we have to they have to be willing. It takes courage. I talk about in my book. I wrote a book, The Way Through Chronic Pain,
Mhm.
Tools to Healing to Reclaim Your Healing. We talked about it. The book, yeah, I talk about that in my book. It takes courage to try something new when you're a chronic pain sufferer. Why? Because remember, I told you the mind has this negative, very exaggerated negative bias.
Mhm.
So the brain on chronic pain says this: oh, something new. Uh-oh, what if I try it and I get worse? And so, and because the nervous system's in this dysregulated state, its first reaction is going to be no, and it's going to be defensive. And you can't defend and connect at the same time. The nervous system's not made for that. Just like you can't rest and run at the same time, right?
Mhm.
So the work with a and Peter was very good at this. I watched him. Oh my God, he was amazing at this. Uh, you have to get the person so that they start to drop their defenses and in your presence and so that they feel safe enough, which is why we do the breath. They feel
Mhm.
safe enough to now you're beginning to co-regulate and now you can learn. So it's a process and there's a little bit of an art to that, but if you kind of understand the basic principles, safety, belonging, then learning, and you know how to bring the safety in, the
Mhm.
rest kind of falls into place. Uh, their willingness and their ability to stand courageously in the face of the unknown and trying something new. I'm not sure I can teach that. I can cajole it and I can tell stories about it and I can, here's the door, I can
Mhm.
hold the door open, but they have to walk through. So, you're putting your finger right on the soft spot of the part of my practice. And good for
Got
you.
it. Got it. I learned growing up that if you're sad or you're feeling bad or you're just internally, thinking about yourself, oh, woe is me or whatever, that the best solution is to go help someone else because then you forget about how you're feeling. And I know when you're really in pain, you don't even want to think about anything. You don't even want to think about cleaning your house. You just want to,
Well, this is the brain on chronic pain that you're referring to.
yeah. So
That
how do
needs you.
we move from that brain on chronic pain to maybe going out into the world and helping someone or doing something or doing some, ha- can that be part of the healing where we're so
Well,
concentrating
I
on
think
someone
it's
else?
important that people take care of themselves first, and then they can look to others. I get it. We talk about service all the time in recovery.
Uh-huh.
That and addiction recovery, that's you get into meetings and you be of service. Um, in chronic pain, the problem is that chronic there's addiction, but before there was addiction, there was chronic pain. And before there was chronic pain, there was unresolved trauma. So, how are you going to work that equation? You have to start with the unresolved trauma, which is why we start with ancestral clearing and breath work.
Mm-hmm.
So, it's a process. The service is kind of a little bit farther into the process. I remember when I got into Peter's program, there was some trouble at home, and I was so used to being kind of, in between, kind of the peacemaker. I was like, oh, I gotta go, I've gotta like get in between this. And my counselor's like, no, you don't. And I'm like, yeah, you. I was so other oriented. I was so used to like, looking out and serving out that I just, they kept saying, you need to start here. You need to
Mhm.
start with you. Fill your cup first, and then everybody else gets the overflow. And that was part of the change that I had to make. With women, and I don't know so much about men, but with women, most of us, as soon as we could walk, we were put into service. So, what is the subtext of that? Others first, whatever's left over is what I get.
Mhm.
And so now you can see why I had that programming and why they had to, had to rewire that. So I get your thing about service, but that's a little bit later in the process. Yeah.
Mhm.
Does that make
Makes sense.
sense?
Yeah, yeah, it does. So if people wanted to connect with you, get your book, what services do you have now?
Mhm. Sure. Yeah, you can find me at my website, which is Elizabeth with a dash, Kipp, KIPP.com. I do individual sessions. I've got, packages. I do group on Ancestral Clearing. And I do sessions on all the different things that I talked about. Um, and uh, and I have there's all kinds of free resources on the website that you can find. I've got some courses. One I've got the Foundations of Trauma Recovery is a great place to start. So there's lots of offerings, but just hop up on the website and you'll find everything. And if you can contact me through there as well. Thank you so much.
Yeah, yes, of course. So now I have a personal question. What gives you the most happiness and fulfillment in your life at this point?
Oh, that's an interesting question. Um, at this point, I really like being of service, but like I said, I have to take care of. I have to make sure that I've got peace and peace and ease is reigning in me first before I can, go out, uh, put it out there for my clients. So it's kind of both. It's like, I take care of me. I have a little cat here, who's a lovely little spirit. Um, I have a son who I adore. But he's older now, so he's not in the house. He's grown, so I don't see him very much. But I love the relationship, and it's fulfilling. And really, the work I do helping others. You know, I was held and helped by so many people over those 40 years. And I remember one time being in the hospital and the nurses walking out the room. And I remember saying to myself, not if, because the doctor said I couldn't heal, right? Not if, but when I heal from this, I hope I can give back one iota of what people had given to me.
Mhm.
And so that's kind of, put me on mission. Yeah.
That's really beautiful. Yeah,
Thank you.
thank you. Yeah, so thank you so much for being on the podcast today and for sharing your wisdom and the breathing exercise so we can all calm ourselves.
Mhm. Well, thank you so much, Kim. It's great to meet you, and thank you for inviting me on to your show.
Yeah, so I have one last question before we finish.
Mhm.
What is your best advice on living an incredible, amazing life?
Well, love is the only answer. I would start there. And the other thing is just in terms of the chronic pain piece. The greatest healer in your life lives within you. Doctors can set a bone and stitch up a wound, but they can't tell the body how to heal. Only the body knows how to do that. So it's important that we remember where the healing power lives. It's not out there, it's right in here. Yeah.
I love that. Thank you so much, Elizabeth.
Well, thank you.
Yeah, we'll talk to you again soon.
Okay, thanks so much.